Bachman. I am a general surgeon at the Inova Medical Group, and this afternoon we're going to talk a little bit about hernias, which I know is something a lot of people have questions about because it's a very common problem, and everyone's always interested if they need to have their hernia fixed. So what I'd like to do is start by sharing some information with you and show some pictures, and then we'll take some questions. So give me a second and we're going to show some slides and pictures because hernias are a very visual thing, and it's nice to have some pictures to look at. So hopefully you can see the slides now. And it's good to start by talking about what exactly is a hernia. A lot of people think a hernia is a rupture, and it is in a way, but when we talk about it medically, we talk about a hernia really being a protrusion of a structure outside of the tissues that normally encase it. And herniation is that anatomic structure moving from its normal position to someplace else. And that can happen in lots of different parts of the body. So you might hear people talk about hiatal hernias or paraesophageal hernias, and those are hernias that are actually inside of your abdominal cavity when the diaphragm widens and it loosens up around the esophagus, and that lets the stomach or even some other organs slide through into the chest. And you might hear people talk about herniated discs. That's in the back when a piece of the little disc that cushions the vertebra, the spinal column, gets fragile and it breaks off, and it can protrude into the canal that carries spinal nerves, and that's what causes a lot of pain in people's limbs. The kind of hernias we're going to talk about today, though, are in the abdominal wall. And one of the most common hernias you hear about are inguinal hernias. And there are some natural openings in the groin which can widen, and if that happens, it allows the abdominal contents to push out through the muscles and to bulge underneath the skin, like in the picture. So we have a picture here of the normal abdominal wall, and you're looking at the groin in a man, and this little cord here carries the blood vessels that feed the testicle, and it carries the tube that carries sperm back from the testicle down towards the prostate. Because those structures start out inside of the abdominal cavity and have to make their way outside to the scrotum, they have to push through the 3 layers of muscle in the abdomen wall. And normally, the muscles are tight around those structures, but if it starts to dilate, then that gives the lining of the abdomen a chance to sneak out through that hole, and the intestines usually come with it. Some of the symptoms of inguinal hernias can be pain or a visible bulge or a burning or aching sensation, especially when people have been up on all their feet all day. Sometimes when you strain to go to the bathroom or cough, something can sort of pop out in that space. And as long as when you lie down or sit down, all of those contents can go back inside where they belong while you're lying down, it's usually not an emergency. Inguinal hernias very rarely become emergencies, but when they do, it's because those intestines get stuck through the hole and they can get kinked off, causing an obstruction which leads to nausea and vomiting, or you can get even the blood supply to the intestines can get kinked off, and that can lead to the bowels having gangrene, which is definitely an emergency. So this is the space in the groin where people can have hernias come, and they're looking from the outside and from the inside here. And you can see that there's the potential for a lot of room for hernias to form. And we have 3 different kinds of hernias in the groin that we talk about: an indirect hernia, which happens over here, a direct hernia, which happens over here, and a femoral hernia, which can happen right there next to the big blood vessels that travel down into the leg. So why is that hole there? Well, it's because, especially in men, when the fetus is developing, the little testicle starts way up high in the back, and it has to push all the way through and down into the scrotal sac. And as it does that, it pushes a little protrusion of the lining of the abdominal cavity with it. So this is why some babies, especially baby boys, are born with hernias, because that little tube of the lining of the abdominal wall doesn't go away like it's supposed to, and it leaves a space for the intestines to push out and through. In adults, it's a little bit different, and we'll use mesh for repairing most hernias in grown-ups. And the reason for that is we use the mesh as a blocker. It's a barrier that covers up that hole, and it keeps the intestines from being able to push through the hole anymore. And over here on the patient's right side, we see the placement of a mesh if a laparoscopic repair is done. And here on the left side is what the mesh looks like if an open hernia repair is done. And another little picture kind of compares the two layers. It's sort of like if you were riding your bicycle and popped the tire, you have two options for putting a patch on. One is on the inside of the tire, and one is on the outside of the tire. And that's really the biggest difference between the two approaches for fixing a groin hernia. And again, that's what the open repair would look like when we're finished. And laparoscopically, a lot of the time we can actually stay outside of the intestinal cavity. We put in a special balloon to make a space underneath the muscles, exposing the hole, and then we lay our piece of mesh in to cover that space. And most people have 3 small incisions when the laparoscopic repair is finished and go home that same day. There are different risks for getting a hernia. As we talked about, some babies are born with them. Sometimes there is hernias that develop as you grow older, and there are different things that can lead to that. When you have patients who are smokers, smoking can affect your tissues and make them weaker, and also the coughing that comes with smoking can affect the pressure inside the abdomen, and that chronic high pressure can lead those holes to dilate. So the chronic coughing that comes with things like COPD and smoking, chronic heavy lifting at work, diabetes, and sometimes certain medications can lead to high risks of hernias. Surgery is another thing that can cause hernias, and we especially see hernias come from surgeries when we talk about abdominal wall hernias. Muscle itself is pretty soft, but muscle has a coating of a tissue called collagen. And those collagen, those thick, tough sheets of tissue, we describe anatomically as fascia. That's what gives our abdominal wall its strength. When you have a surgery and somebody needs to cut through the abdominal wall and you heal afterwards, the best healing you can do is to about 80% of the original strength of your abdominal wall. And any of those things we talked about on the prior screen can lead people to have that repair pull apart and develop what we call an incisional hernia. Sometimes people are born with small holes, and those are what we call primary hernias. And we see those especially at the belly button, which really is a scar if you think about it. Sometimes up in the middle part here underneath the breastbone, people can get hernias. A lot of times, as I mentioned, we see hernias or holes developing in the abdominal wall where an incision was, either after a midline incision or sometimes after cesarean sections, or sometimes if somebody has had a stoma like a colostomy or an ileostomy, we're actually creating a hole in the muscles, and that can cause a hernia to form around it. So when we look in cross-section at the abdominal wall, you can see all these different layers here, and usually it's an incision that makes that hole through all of the layers, and then the tissue pulls apart. So here's a really bad belly button hernia. You can see that it is even ulcerated. And inside, some of the fatty curtain that covers the intestines was stuck inside that hole. That was very tender and painful for the patient. We pulled the tissues out, and you can see what that hole looks like on the inside. And then we fixed the hernia by putting the piece of mesh up as a barrier so that nothing can pop through into that space and get stuck anymore. And then that skin can heal once the pressure is released from it. Just like with the inguinal hernia repair, there are a couple different ways of fixing it. That's the same with the ventral or abdominal wall repair. So it can be done open with or without mesh, or it can be done laparoscopically with mesh. And the reason why we'll use mesh a lot of the time is because the studies that we've done following patients out who have had surgery show that having a piece of mesh which overlaps onto healthy tissue around the hernia reduces the risk of the hernias occurring to about 5% or less. Sometimes with a big hernia, if you just try to sew it back together, it's more than half of those patients will have their hernias come back again. So that's the end of the information that I put together to show you. We'll see if there's any questions that anybody has about hernias and things that we can answer. So here's one that asks, at what age am I at risk for a hernia? Well, we talked about, especially in the groin and the belly button, as being two sites where people can be born with hernias. So even babies can have them. Sometimes at the belly button, the babies heal their own hernias. Most of the time, the groin hernias have to be fixed by pediatric surgeons. As people get older, you really can develop a hernia at any age. Certainly, with cumulative risk factors like smoking and heavy lifting, we can see people developing hernias more frequently. But we see patients of all ages, from in their adolescent years, their 20s, all the way up to their 80s and 90s, developing new hernias. So another question is asking, are hernias hereditary? Meaning, can you inherit them from your parents? There may be a little bit of that risk. There are certain diseases that we know about where people have mutations in their wound healing and their collagen. Those are pretty rare, though. We know that if a patient does have one of those, they are at risk for a hernia, especially if they have an operation for any other reason. Most of the time, we don't see hernias as being inherited, though. It really depends on each individual person's body. This is a good question. It says, should I be wearing a special brace when I lift weights or move heavy objects around to avoid injury? Well, it really depends. Lifting should always be done carefully, and you really need to make sure that you're using your legs and you're not hurting your back and you're not straining. We certainly have seen people develop hernias from lifting weights, and a lot of the times that's when they're really pushing and straining. Most of the time when we fix people, they can go back to their activities, but I always tell people to use common sense. And really you shouldn't be moving 100-pound pieces of furniture around by yourself without help. You're at risk for injury for lots of other things as well. So it's always good to be careful when doing heavy lifting. A brace might help you feel that you have more support, but nothing really can prevent a hernia if a tear to the tissues occurs. This question is asking, who's more likely to get hernias, men or women? And because of the testes and the fact that they have to push through the abdominal wall, men have more of an opening in the groin. So we definitely see inguinal or groin hernias being more common in men than women. Women can get hernias for sure. They're just less common, and usually we know a little less about them because they happen so infrequently. The women will be at risk, especially as they get older, especially in the groin, that femoral area that we talked about. So down near where the blood vessels going to the leg are, we see in older women will frequently dilate up and can get a hernia there. In terms of the hernias of the abdominal